Every day we are hit with new information about the coronavirus, or at least it seems that way. I know it can be overwhelming, but one doctor says that it's time for us to change the messaging around the virus. And 10 Tampa Bay's Jenny Dean talked to that doctor who was on the front lines in New York City back in April and March. And Jenny, he's saying that in order to flatten the curve, we need to change the messaging. Good morning.
That's right, Rob. He says, we should learn more to be less afraid. He says he's noticed two groups of people, those that are scared and won't even come out, and those that simply don't care and are doing whatever they want. And he says it's time that we all work together to fight this virus.
We need to lose the fear, but gain respect. And I think the respect for the disease, or we're losing that respect as a society.
Dr. Jaime Salas-Rushford was on the front lines early on in hard-hit New York City. He says we know so much more about coronavirus now that slowly reopening businesses and schools is possible if it's done right.
We now have knowledgeable ways of preventing spread. We need to create that part of society that it's sociable, that it's interactive. And also they need to learn, like people who are sick can stay home. There's responsibility.
He also says right now, we shouldn't be counting on something we don't have, a vaccine.
What we know right now is there's no vaccine. What we know right now is that we can treat symptoms. What we know right now is we can do to prevent the spread. But I think people are resting their hopes in this vaccine rather than just learning how to cope with this, because I am sure COVID is not going to be the only virus in the next decade to hit us.
So what does Dr. Salas-Rushford say we should be doing? Well, first he says keep your immune system strong by eating healthy, getting exercise, and plenty of sleep. He also says to take precautions, wear a mask, socially distance, and wash your hands. Also, treat your symptoms. We know how to do this at home. If you do get sick, you'll most likely have a fever, diarrhea, and dehydration. We can treat a lot of those symptoms with a fever reducer by drinking lots of fluids and getting lots of rest. But here's the thing. Doctors are very readily available, so don't let those symptoms get out of control trying to take care of them yourself. If you notice you need a doctor, you can get a hold of one through a televisit or a virtual visit. It's really that easy. He says if we start doing these basic common sense things, then we could lose the fear and gain respect for the virus and hopefully flatten that curve, Rob.
Well, Jenny, the doctor makes a good point. This virus is novel. It's still new. It's only been around for 5 months, and new information is constantly coming out about the virus and how we can treat it. And that's another great reason to watch us here on Morning News, because we're trying to keep people apprised of all of this flood of new information.